If you've been diagnosed with type 2 diabetes and you're wondering what treatment options are available, I'm going to talk about them in this video.
Let's go.
Hi there, Coach Tonya, a holistic health practitioner with Criticalbench, and thank you for joining me. In this video, I'm going to be talking a little bit about treatment options that are available to you if you have been diagnosed with type 2 diabetes. But before I get into that, I want to tell you about a great product we have. It's in that pinned comment below. If you click that, it's going to take you to a link where you can learn all about our metabolic stretching program. This is really a groundbreaking program that can help you lose weight through a series of stretching programs. Now, you don't have to be a super fit Olympic level athlete. This is great for beginners. This is great for seniors. This is great if you have joint pain. This is great if you're struggling with balance or mobility and flexibility is an issue for you. It's also great if you are someone who is carrying extra body weight, maybe overweight, obese, and you need to start exercising to lose the body weight, but getting into an intense strength training program or going to a gym is just not something you're going to do. You're going to want to click that pinned comment and find out all about this program because it is going to help you, okay? So, treatment options for type 2 diabetes. Well, type 2 diabetes, when looking at type 2 diabetes, there isn't like a Band-Aid fix or like a one-stop shop solution for it. You have to be very diligent and you have to be committed to really a lifestyle change. Okay. Type 2 diabetes is something that you actually have a tremendous impact on with lifestyle choices that you make, and you have to be willing to own that. Okay. You don't get to sit back and go, this is what life handed me. No, you actually had a part in that. And you can have a hand in making some massive changes in how you feel and how often you need insulin and what kind of therapy you have to do, what kind of treatments you can or cannot do. You need to have an amazing communication system with your doctor. Okay, when it comes to something like type 2 diabetes, where you can make lifestyle changes that have an impact, you've got to be continuously, not every day, but you need to have an open line of communication with your doctor. You need to be talking about what you're doing. You need to be discussing how that's affecting you and if it's working or not, so that they're part of that process to help you kind of narrow in and focus on what changes are having the greatest impact in improving your condition. A doctor is also based on what you're doing and the feedback you're getting in your body and the feedback he's getting from you as to how things are working. He's going to be able to determine how often you need to be checking your blood glucose levels. So part of treating type 2 diabetes is basically in the management of it, okay? So I use the word treatment in the title of the video, and I'm using the word treatment in talking about it, but really, in essence, what we're talking about is managing it, all right? So some of the things you can do is making sure that you are including really high fiber foods, so like healthy carbs, whole grains, fresh leafy green vegetables, things that are really high in fiber and that are the good carbs, okay? And we want to keep the refined carbs, the sweets, the cookies, the cakes, we want to keep those to a minimum, or, like minimum, okay? You also want to make sure you're eating regularly. Our bodies, whether you're type 2 diabetic or not, our bodies respond really well to routine. They like routine. This is a machine. This thing is a machine. And how many of you have a routine with your vehicle? Getting the tires rotated, getting the oil changed, checking the filters, changing them when they need to be changed, tune-ups, all of the service checkups for your vehicle. So if you're going to put that kind of effort into your vehicle, by all means, please tell me you're doing the same with your body. Now, I realize that sometimes the routine gets thrown off. We travel, sometimes we get sick. Life happens and can throw our routine off, but that's short term. If you do have a really solid routine, you're eating regularly, your body is going to respond very well to that. And that also has a really awesome impact in helping to maintain blood glucose sugar levels, because it's not like you've missed 3 meals and then you have this huge, at 10 o'clock at night, this huge meal, and you have the steak and the lobster and all the extras, and then a piece of cheesecake for dessert, and your blood sugar levels are just okay? So eating regularly is a great way to help manage your type 2 diabetes, all right? Do not eat till you are stuffed, like uncomfortable stuffed. And we've all done it. I've done it. You know, Christmas dinner or Thanksgiving, my favorite meal of the year, where we have a tendency to overeat because it's all of the things we love the most. And they're not things that we typically make regularly, or, you know, maybe we only make them that one time a year. So we eat as much as we can because we just love it. It's so good. It's comfort. It feels good. It tastes good. And then all of a sudden, it's like it hurts to blink. It's so painful. Okay, you don't want to do that. Again, that's affecting blood glucose levels. All right. So eat till you're comfortable. Eat till you're comfortable. Be in a caloric deficit. Statistically, the people that are most affected by type 2 diabetes are overweight. Okay. Now, the only way to lose weight, exercise, good nutrition, exercise, when you put those two together, it has to be in a deficit, because you can be exercising 5 times a week, but if you're consuming way more calories than what you're burning, you are not in a caloric deficit. And if you are not in a caloric deficit, you are not going to lose weight. So, you know, especially if your type 2 diabetes is directly linked to the fact that you're carrying excessive body fat and you're overweight, you've got to get yourself into that caloric deficit and start losing the weight to help yourself, okay? So be in a deficit. Now, don't be in a deficit to the point that you're starving. Be in a reasonable deficit so that the exercise you're doing is burning what you're eating plus, okay? 30 minutes of aerobic activity a day. That's very good for your heart, and it's also very good for your blood sugar levels, and it's what is recommended by doctors. So if you think you have to get into a gym and start doing deadlifts, you don't. If you get there, that's great. But 30 minutes of cardio or aerobic activity a day. That could be a bike ride, that could be a walk, getting on the treadmill, okay? 30 minutes, that's all. You need to be very diligent and consistent with all of this. Type 2 diabetes, you can't start doing the good work to manage it better and then get great results and then just stop. This is a lifestyle, folks. This is a lifestyle that you have to be committed to and live to continue managing it, and hopefully, possibly even reverse it, okay? Because it has happened, it can happen. It's not what happens all the time, even with making the lifestyle choices. However, committing to and being consistent with better lifestyle and doing a lot of these good things is going to impact those blood glucose levels to the point that your need to take insulin can be like rare cases, rare occasions, all right? And this is, again, something that the doctor will tell you what that will be based on the results, okay? Not everybody with type 2 diabetes needs insulin. A lot of times a person can be diagnosed and the doctor will say, you have got to lose some weight, you have got to start eating better, you have got to start exercising more. A lot of times they will do that, and I applaud the doctors that do that, okay? Because that, to me, indicates it being sort of caught on to early, gives you a greater chance for the possibility of reversing it. Now, as far as treatment options, okay, so we've talked about managing it, because that's number one. That's in my opinion, that's the best thing you can do. Start managing it better. Start managing it, okay? Now, when looking at specific treatment options, because sometimes in severe cases, nutrition and exercise just don't do enough, and we need to bring in medication. And I wrote these down because I hope I say these right. I actually Googled the pronunciation of some of these because I was like, there's just no way. But here goes, because these are drugs that I am not, I've heard of them, but they're not ones that I say all the time. So metformin, this helps lower blood glucose levels, and it helps improve your body's response to illness, to insulin. So metformin is one of the medications that can be prescribed to you. Sulfonylureas, they're a type or a group of drugs that actually help your body to make more insulin. Meglitinides help stimulate the pancreas to make more insulin. So those are the sulfonylureas and meglitinides work the same way. They're just different classes. GLP-1, this helps slow the digestion and improve blood glucose levels. So, when I talked about making sure you're eating regularly, you want to make sure you're doing that, okay? But again, if the changes you're making as far as nutrition and diet aren't having the impact that you and your doctor are wanting, a GLP-1, so that's a glucagon-like peptide, might be prescribed to help with that, okay? Sodium glycose cotransporter 2, that's a mouthful, okay? Or SGLT2, which kind of sounds like a band, okay? Now this is a drug that I'm really not all that familiar with at all, and it actually helps the kidneys from reabsorbing glucose into the blood and sending it to the urine. So that was a new one for me, not one I'd heard of before the other ones I have. Now, there are other drugs that may be prescribed to you by your doctor. Those are the ones that I mentioned are the ones that I was more familiar with, had heard about before, had read studies on them before. So those are the ones I wanted to talk about. Now, of course, with any and all of these, there can be side effects. So it might actually, your doctor might prescribe something that they think is going to be the best option for you, and it turns out that you are experiencing side effects that are worse than the benefit of taking the drug. So it can be a little bit of a game to figure out what works best, or if a combination is needed. But what I will say is that if you are doing the management part, being very diligent in the management part on your own, I would think that finding a medication that works with you to further help if needed would be easier, and you would probably minimize your chances of a lot of side effects that could potentially be there. So really, if you have that diagnosis, if you've been told you're type 2, and if your doctor has said, lose some weight, clean up your diet, get moving more, those are 3 very powerful things that you can do, and why wouldn't you do them? Why wouldn't you do them? Okay, thank you for watching. I really enjoyed talking to you today about the treatment options for type 2 diabetes. Don't forget to check out that pinned comment for that fantastic program, Metabolic Stretching, Stretch Your Way to Lean. You want to check it out. It's fantastic. I'm Coach Tonya, Holistic Health Practitioner with Criticalbench. Don't forget to give the video a thumbs up. Make sure you hit the subscribe button and that notification bell so you never miss any of our great video content. Have a fantastic day, and I'll talk to you soon.